Hey, hello, everybody. Talk a little bit about qualitative research today. I got the title here of More Than Words, so turning data into story. So to start, let's imagine this. So you want to study why people in a rural community aren't showing up for free health screenings. A quantitative survey tells you only that 40% didn't attend. See, that's interesting, but it doesn't tell you why. So to uncover that, you have to sit down with some of the people and say, get some other information, right? So someone may say, I don't trust the clinic. Another says it's on market day. I can't afford to miss work. Maybe I have to take my dog to the vet on that day. Maybe I have childcare issues on that day. Now you're getting somewhere. Now you're getting to the why. Why aren't they coming to the free clinic? Right? So what qualitative research does is it seeks to understand how people experience the world. So it's about how they feel, what they believe, and how they make decisions. And so for methods for this, we have interviews, we can have focus groups, we can do just observation, we can have open-ended surveys, you can analyze text, audio, video, field notes, photos, feedback on surveys. So it's about depth. It's not just about numbers. So I got this little slide here that kind of shows the difference between quantitative and qualitative. So under the quantitative column, we have, the goal is to measure. The data we're talking about are numbers. You can do the tools, you could do surveys with closed questions, and then you might have some statistical software that runs all the fancy stuff in the background. And we're going for generalizable results. So we want whatever the results of our quantitative research to be generalized to the population where the sample came from. And we're going to use our statistical tests and statistical software for our analysis piece. But for qualitative, we want to understand. So it's not so much about measuring something, but understanding something. And so we're going to use words, images, themes, trends as our data. For our tools, we're going to have interviews, the focus groups, all the stuff I read previously. And the outcome we're going for are rich insights. And often we're looking for very context-specific insights. And so for our analysis, we're looking for themes, narrative, or content analysis. So the quote here, we have quantitative tells you what is happening. Qualitative helps you understand why it's happening. Now, this is just these aren't unique just to qualitative data, but just for some advantages and disadvantages of it. Advantage, it's useful for very complex subjects. It gives you that in-depth, comprehensive thing where you're going for that greater understanding of the entire situation. So we're looking for the interaction between the variables. So we want not, and this is really cool. You don't have to have these huge, large samples to get this. Actually, if you did 5 interviews, that's pretty good for qualitative, and you get very unique results. Now, the disadvantages of this is you don't need a simple hypothesis. It can be subjective, so it can be difficult establishing reliability and validity, right? And it has a limited scope because of that data collection. You always have investigator bias. You can have that in quantitative too, but we have it here too. Qualitative research requires really detailed planning, and it takes a long time. It takes a really long time. So you don't get any precise results with mathematical collections, and oftentimes these studies can't be replicated, and we lack generalizability. So those are just some advantages and disadvantages. But again, these aren't solely belong to qualitative research. These things can be found in other kinds of research too. So we're going to look at an example, and I'm going to tell y'all, I have some public health examples in here because that's what my latest degree is in. And I didn't take them out because I see public health, the questions asked in public health and the questions we ask in our world, information sciences and library stuff. I see those as very parallel. So I left the public health in there in the hopes that as we go through this, you'd be thinking up some of your own things and some of your own examples that maybe somebody will be brave enough to share in the chat. So we've got this example, got a polio campaign in India. The quantitative data shows low vaccine uptake in some communities, right? So now we've got to figure out why. Why is there low vaccine in just some communities? So we go in there and we apply qualitative methods, and we find that certain villages or certain communities have a fear of becoming infertile. Maybe this other community just does not trust healthcare workers for whatever reason. Maybe there's just a lack of understanding about the vaccine, and there could be a whole host of other reasons too. So by listening to the people, you can redesign the campaign to address what you found out of the qualitative research and design the message and the approach to take care of those issues you found while doing your qualitative research. So if we're thinking in terms of libraries and advocating for things and developing programs, and we say, gosh, this program isn't working, only 50% of the people showed up. Then we go to the qualitative, right? And we ask those people, why didn't you show up? Well, it could be something as easy as, unexpected rain, we didn't want to go out in the rain. Right? Well, there's nothing you can do about that. But it could be that the room is always too cold and we just can't be in that room, it's too cold. So you find another room. So it can be simple things like that. And as we see, it can be a lot more complicated than that too. So there is a great debate between qualitative and quantitative folks. So we'll say textbooks and oftentimes researchers too, they'll frame this as a debate, right? So, and sometimes they'll get mad about it and get all rivalrous about it. They'll say, no, we need the objective scientific numbers, but we need the words. We need words to reveal the truth that the numbers can't. And so we have a few little strengths and limitations just in this little chart. With the strength of a quantitative research project, sometimes, not all the times, you get larger samples, measurable outcomes, and that generalizability. But what you miss is the context, and it doesn't capture emotion or nuance. So the qualitative comes in and it's going to address that limitation with that rich detail, that personal insight, and explore that complexity. And then again, we have the limitations, smaller samples, not generalizable, and extremely time consuming. Okay. So there's all kinds of qualitative designs. I picked 4 to look at for this 30-minute session. And I picked the 4 that maybe folks are least familiar with. I mean, we all get the ideas of interviews, and interviews can be structured or unstructured observations. Everybody kind of knows what a case study is. And everybody kind of knows how you analyze historical documents looking for trends and verbiage and how people felt about things. But we got phenomenology, content analysis, ethnography, and then grounded theory. And I was thinking that maybe those would be the most interesting for this particular presentation. So what is phenomenology? So it's studying the lived experience. So what it does is it focuses in on understanding how people experience a specific phenomenon in their own words. So it's less about facts or outcomes. It's about what it feels like to go through something. So this helps us understand the meaning that people attach to experiences. When to use it. So this is like you're going to ask, what's it like to live with, say, chronic disease, right? What's it like to live LGBTQT in their daily lives? What's it like to live post Exxon Valdez or post BP Gulf oil spill in your daily life? Surviving a natural disaster. What's it like being a caregiver for a patient with dementia, right? What's it like navigating college with a mental condition? All of those things fall under phenomenology. Right? Now, what you do after you collect your data, and you would probably collect data through for one of these things. The students I've seen use it in interviews, and we just recently had a student do a project where they looked at vaccine uptake in a Hispanic community, and they interviewed people in that community to see if they could find those themes keeping them from getting vaccines, right? And so we're going to analyze the text. That text could also be media coverage of an event, communication to find patterns, themes, or messages. So in public health, right, we often use it to study health campaigns and messaging, right? You could use it to discover examine news coverage of health issues. Social media content, that's a cool one. Policy language, how does the policy frame what's going on? But this could be used in libraries for all kinds of programming events. What's going on in that community, figuring out what it feels like to live that, then gives you some ideas of how to help, right? So the goal is to uncover what's being said and how it shapes understandings, beliefs, and behaviors. So how do you do a content analysis? You choose your content, right? So CDC tweets about COVID, right? Decide what you're looking for. Looking for topics, tone, frequency, language used, framing, etc. Right? And then you're going to create codes. So you'll have an example: prevention, vaccine promotion, and myth busting. And then you're going to systematically review and code these things. So you're going to tag and or count how often each theme appears. Then you're going to go and analyze it. What's emphasized? What's missing? How might it influence public understanding? Right. So here we have a media portrayal of the opioid crisis in local newspapers. So the researchers analyzed 50 articles over 5 years, and the codes they came out with were stigma language, solutions mentioned, source of quotes, and whether those were law enforcement versus healthcare, et cetera. And what they found is that most articles used crime-focusing frame, very few referenced treatment options, and language often reinforced negative stereotypes, right? So if we're looking at that, we'll say, well, the insight is for our public health messaging, we need to counteract those media narratives to reduce stigma. That can be, this sort of thing can be used on campuses like for any topic, which includes libraries and, just anything really. Now in the ethnography, this is studying culture through immersion. So ethnography is a research method where the investigator actually goes into the community and spends time in that community to understand its culture, norms, and everyday life from the inside, right? So this, of course, came from anthropology, but it's also used in public health to understand health beliefs, behaviors, barriers to care, cultural attitudes toward illness or prevention, and community responses. It's all about context, connection, and culture. So these usually include long-term observations like over weeks or months, very deep engagement with the community. So we have interviews, participation in the community, and taking field notes. And so you're going to focus on meanings, rituals, and the daily lives of the community you're looking at. So in this case, the researcher actually becomes part of the setting while still observing critically. It's about asking asking people to tell me about your world. Let me see it through your eyes. So that would be, how cool would that be to do that with a group of students and the library, or asking for tutoring or any other service on a campus? Participate in community life. They attend events, help with local projects. And you can take the detailed field notes. You can do informal, formal interviews, and you're trying to observe those social interactions, routines, symbols, and space. So it's very important for this. This is not about judging. This is about understanding behavior in context. Now, grounded theory is constructing theory from the ground up. So it's used to develop a theory based on data collected from real people and real experiences. So instead of starting with a hypothesis, the researcher begins with a question and lets patterns in the data shape the theory. That's cool. It's research where the data drives a discovery. So you want to use this to understand a process, interaction, or a decision-making pattern. So there's no existing theory that fully explains what you're studying. You want to create a framework or model based on that lived experience. So you're asking questions like, how do people decide to seek care? What processes do communities use to organize after a disaster? Another question may be, how do people manage chronic illness over time? So you start with a broad question, not a specific hypothesis. And for those of us that think broadly, this is like a natural fit. So here's another example of a broad question. How do people recover after experiencing homelessness? Okay. So we can collect the data, usually interviews, but you can also do documents and observations or a combination, and you're going to code as you go. And there are different ways to code. There's open coding, axial coding, selective coding. That's kind of a little bit outside of the scope, but there's more than one way to code. Then you're going to build a theory based on repeating ideas, actions, and stages found in the data. So you're not proving a theory, you're making one. So how do you analyze all this data? Because if you think about, you're looking at transcripts and documents and pages and reams of paper, how do you go in there to find the patterns and themes, meaning of words, meaning of actions or experiences? So unlike quantitative data, you don't necessarily put it in software and run the numbers, right? You have to read, reflect, organize it, and interpret it. So we have a couple steps to this. You're going to transcribe all this stuff. So, hopefully you've gotten permission to record everything. You have your notes. So you get everything transcribed. You read it, you reread it, and you code the data. So you have tag words, phrases, that kind of thing. So you may tag a whole paragraph with, this paragraph talks about trust, access, fear, and family support. Right. And then you group them into larger themes that show up across participants. So we may say of my, we'll say 25 participants, trust came out as the main theme. Right. Then we're going to interpret what those themes mean in context. What story is that data telling us? What patterns or surprises emerge? So the job here is to make meaning from people's words. Now, how do you organize all this, right? This is a lot. So you organize it with transcripts. You got the notes, the documents, and more. You got to make sense of it all, and you're going to use an organizational system to code and analyze and sort all of this. Now, you've got two main approaches. You have manual, doing it by hand, and there are qualitative data analysis software. there are software packages that can help with this. Manual organization, you can print the transcripts, use your computer to highlight, underline, or color code by hand, sticky notes, index cards, whatever works for you. Though that's common in small projects in student research. One student transcribed the entire Barbie movie and then went in there and started coding all the feminist, the women promotion part, the stuff that maybe wasn't so nice, and coded this whole thing and came out with this really cool research paper based on the Barbie movie. She also said after all of that, she never wanted to see the movie again, which would have been, understandable. But the other part is computer assisted qualitative data. And so this allows, oh, I can't share that paper. This is a high school group that I do some stuff with here on research, on qualitative research. And so I'll see what I can get. But probably not the whole paper. So if you have the software, you can upload and let it code the data and organize the themes, searching on keywords or co-occurring codes. And then it can also do the visual connections, charts, and word clouds and models. I don't know, anybody that just groaned when I said word clouds is because you got to do it right. You got to do the word cloud. The word cloud can be a nice visual, but you have to do it right. And you have to go through there and identify the themes so that the actual thing that needs to be the big word in the word cloud is the big word, right? But that's a whole other thing. All right, so it's very efficient for large projects, multiple researchers, or multi-site students. Coding is a process of labeling chunks of qualitative data with words or short phrases that capture their meaning. So you're tagging key ideas in interviews, field notes, or your documents, and it helps you organize the data to find those patterns, themes. So you say it's like highlighting with a purpose. So the student that I just referenced with the Barbie transcript, she had, I don't know how many colors of highlighters and had gone through and highlighted, and so they had feminism. That may not have been the actual word, but feminism. So like everything that had to do with feminism coded green. Then when you get everything coded, you pull all that out and look at it by itself. It's really something. All right. So you can have more than one type of code, right? So we have descriptive codes, and that just kind of summarizes the basic topic. So we're back to our public health, medical kind of stuff. Does transportation seem to be the overall theme? Does cost of care or the clinic not open hours where people can get to them? There's also interpretive codes. So these capture meaning or emotion. So those are feeling dismissed. I don't trust the nurse. Frustrated if I'm 2 minutes late, they cancel my appointment. Those kinds of things. Or if I don't cancel within 24 hours, I don't get in for 6 months. So anything that has to do with frustration, you would add under that. And then they have in vivo codes where you use exact words. So like, I just gave up. They don't listen to people like me. So we have this little example here is pretty good. So we go from raw data to themes. So if you have the interview transcript excerpt, so I have to take 2 buses to get to the clinic. If I miss one, I'm late and they won't see me. So we have our codes here, yellow for transportation, green for missed appointments, and red for frustration. So that would be your highlighter or your font color or ever how you're doing it. And then the theme for these are barriers to constant care. So that's data reduction and action, moving from quotes to codes to themes to insight. Now, what do? You've got great ways to use quantitative data. You've got great ways to use qualitative data. and they're more powerful together. So what do? My favorite thing, mixed methods. We use both. We use both. I love mixed methods research, right? So it's going to use that survey to measure uptake, and then it's going to use some interviews to see why or why not the person agreed to get the vaccine. So we're validating the findings in multiple ways. We've got both depth and breadth, right? And this can help us make more responsive policy and programs because we know both. So in public health, and I would think, in everything else, having both is more effective, more equitable, and more sustainable. So we need both to see the full picture, right? Quantitative shows us the scale of the problem. Qualitative tells us how it feels to live it or the why, right? So here's one. Why are students skipping mental health counseling on campus? So the quantitative survey says 60% say they're too busy. But the qualitative interviews say they're not sure counseling is confidential, right? Observation, you go, look, oh, the clinic has no private entrance, so people feel like people are seeing them go in there, right? So each one of these adds a piece. So if they're too busy, okay, well, that's another issue. But if they're not sure it's confidential, oh, there's no private entrance. Well, then we've got a rich picture, right? We know we've got two things to work on at least, making sure that the students have time to do this, working on building trust in the whole process being confidential. And that, whoops, is what I had for you today. So if anybody has any questions they want to pop in the chat.
Or feel free to unmute yourself if you want to ask a question. Also, we have a couple minutes of our time left. It's great. Oh, IRB.
IRB. So here's what I've learned about IRB, and thank you for saying it's great. We're still talking about human subjects. If you're interviewing a human subject, if the humans are involved, then you do IRB and let them tell you whether or not you need IRB, right? because there's not only the official like federal rules, but each institution can have local rules. So I could sit here and say, I know at USC I don't have to go through IRB. I don't know that for a fact, but I could say that because if I was familiar with the rules and say, but that doesn't mean you don't have to where you were. So my recommendation is to always do the IRB. About the only time it doesn't apply is when it's quality improvement of a program. That's what I've learned, but I still check with the IRB office. Because you don't want to get into doing all of this stuff and getting ready to publish and they are like, whoopsie, you should have done IRB. So just go ahead and check with them first.
All right. Any other questions, comments? Yeah. Righty, since I'm not, thank you, Lisa, for getting that up. Let me, so our next presentation will be next Tuesday. And it'll be on, like pyramid or funnel. It's a really interesting topic because I've had issues with the evidence pyramid myself for a while. So I'm interested to see how that goes. So let me pop our survey link and YouTube into the chat. And Thanks everyone for coming. No, someone's looking forward to Alexander's next week. Yeah, Alexander was here for this one too, so I am too. Any other questions, comments? If not, we'll go ahead and sign off. Thank you so much, Lisa.
Thank you.
Bye.